Rezum therapy is a novel treatment of benign prostatic hyperplasia for the management of lower urinary tract symptoms. It uses water vapor thermal therapy to cause instantaneous localized cell death. Its indications include men over the age of 50 years with a prostate volume of between 30 to 80 grams. Rezum therapy is advantageous because it can be used in prostates of various morphologies, including large middle lobes. It can also be used in anticoagulated patients and is capable of preserving sexual function. Finally, it can also be performed without the need of a general anesthetic. All patients considered for Rezum therapy should be assessed with a complete urological and sexual history as well as physical examination. A flexible cystoscopy, PSA, and urine culture should be performed prior to Rezum treatment. Functional urodynamic studies are usually not required but should be used if there are questions regarding patient suitability. Patients must be clearly informed that the post-procedural course may include 2 to 3 weeks of storage symptoms, and these may not improve until 1 month post-treatment. This is a case of a 69-year man with voiding symptoms who failed alpha blocker treatment. His prostate was benign and had a volume of 34 cc on ultrasound. His average flow rate was 8 mL per second, and he had a residual volume of 296 mL. He also had a large middle lobe, which was noted on flexible cystoscopy. His IPSS score was 20, and he had good sexual function with an IIEF score of 21. Patients undergoing Rezum treatment are positioned in the lithotomy position and prepped and draped to maintain sterile conditions. The Rezum components and standalone radiofrequency portable generator are positioned near the patient and comes with its own sterile water. The Rezum device needs to be positioned over a user-supplied 4mm 30-degree 30cm rigid cystoscope lens. After priming, the delivery device is placed into the urethra and advanced to the bladder. Once entering the bladder, the length from the bladder neck to the veru is measured. One field of view represents 0.5 centimeters. Treatment should begin 1 centimeter from the bladder neck, moving towards the veru in 1 centimeter increments. Each treatment of steam takes 9 seconds, but it is recommended to keep the needle deployed for an extra 2 seconds following treatment to ensure that the phase change of water vapor is complete. Once the first side is completed, return to the bladder neck and repeat the treatment along the contralateral lateral lobe and then commence on the middle lobe. When a median lobe is present, the same procedure is done but should be completed on either side of the median lobe. The procedure time for treating this 34 cc prostate was 4 minutes. After therapy is completed, a 16 French Foley's catheter is inserted and removed at the 1 week mark. The patient can then return to their daily activities. Our patient was reviewed at 1 and 3 months with uroflowmetry, and his alpha blocker therapy was weaned over 4 weeks. He now has no voiding symptoms and is very satisfied with his urinary flow. In conclusion, Rezum thermal therapy provides the urologist with an efficient, rapid treatment that can be used in anticoagulated or poor surgical candidates. The majority of perioperative side effects are minimal and transient, and there is a low risk of long-term catheterization or impact on sexual function. As such, Rezum should be considered as a safe and effective treatment of lower urinary tract symptoms secondary to BPH.